Lung cancer is one of the most devastating diseases globally, responsible for more deaths than breast, colon, and prostate cancers combined. According to the World Health Organization (WHO), lung cancer causes over 2.2 million new cases and nearly 1.8 million deaths each year, making it the leading cause of cancer-related fatalities. What makes this disease even more concerning is that over 75% of cases are diagnosed in the later stages, when treatment options are severely limited and survival rates drop significantly. Unlike other cancers that may present early warning signs, lung cancer often progresses quietly, with symptoms appearing only when the disease has advanced. By the time most people seek medical help, the cancer has typically spread beyond the lungs, making it far harder to treat. In recent years, lung cancer cases have been rising, largely due to increasing exposure to risk factors such as smoking, air pollution, secondhand smoke, occupational hazards, and even genetic predisposition. As air quality worsens and harmful chemicals become more prevalent in our environment, the risk of developing lung cancer is higher than ever. However, early detection can make all the difference. Research shows that when lung cancer is diagnosed at an early stage, the 5-year survival rate can be as high as 60, compared to less than 10% in advanced stages. This highlights the importance of recognizing the early warning signs, which is exactly what we'll be discussing today. In this video from Health Horizon, we will explore 10 key symptoms of lung cancer that you should never ignore. Whether you are at risk or just want to stay informed, recognizing these signs could ultimately save your life. Let's dive right in. 1. Severe fatigue. We all feel tired from time to time, perhaps due to a lack of sleep or overworking ourselves. However, excessive fatigue that doesn't improve with rest can be a serious red flag. Cancer-related fatigue is different from the normal tiredness most people experience. It's an overwhelming sense of exhaustion that doesn't go away, even after a good night's sleep. This could be due to the cancer using up the body's energy reserves or anemia, a common side effect of lung cancer. Anemia occurs when there is a decrease in red blood cells, which are responsible for carrying oxygen throughout the body. Tumors can cause anemia by bleeding or disrupting the body's ability to produce enough healthy blood cells. With lower hemoglobin levels, less oxygen is delivered to the body's tissues, leading to fatigue. Cancer cells themselves are also known for their high energy demands. As they grow and multiply, they consume a significant portion of the body's resources, leaving you feeling drained and exhausted. 2. Swelling in the neck and face. Swelling in the neck and face may be linked to allergies or other conditions, but it can also be a sign of lung cancer. This type of swelling is known as superior vena cava syndrome (CVS), and understanding why it occurs is key for effective treatment. The superior vena cava is a large vein responsible for carrying blood from the head, neck, upper chest, and arms back to the heart. When lung cancer causes a tumor to form in the upper right part of the chest, it can press against this vein, blocking blood flow. As a result, blood can no longer drain efficiently from the head and upper body, leading to noticeable swelling in these areas. Additionally, lung cancer can spread to the lymph nodes in the chest and neck. Lymph nodes are small, bean-shaped structures that help filter out harmful substances and fight infections. When cancer spreads to these nodes, it can cause swelling and discomfort. These glands are a crucial part of the immune system, helping to filter out harmful substances from the body. When cancer cells block or reduce the flow through these lymph nodes, lymphatic fluid builds up, resulting in noticeable swelling. This is particularly true for the lymph nodes located above the collarbone and in the neck. When these lymph nodes become enlarged, it can lead to swelling in the face and neck, serving as another warning sign of lung cancer. 3. Persistent or recurrent infections. Frequent or recurring infections, especially in the respiratory system, can be incredibly frustrating for lung cancer patients. But there is a deeper connection that explains why these infections keep coming back. Understanding this relationship can be essential in maintaining a better quality of life. One of the main reasons for recurring infections, like pneumonia or bronchitis, is the blockage in the airways caused by a tumor. When a tumor grows near or in the airways, it partially blocks airflow, trapping bacteria, viruses, or other pathogens in the lungs. This stagnant air and pathogen buildup turns the lungs into a breeding ground for infection, and if the blockage is not addressed, these infections tend to return. Additionally, lung cancer affects the lung's ability to clear out pathogens and debris. The lungs have natural cleaning processes, including tiny hair-like structures called cilia, which help remove contaminants and excess mucus. However, if a tumor affects these areas, the lung's natural defense systems become less efficient, leaving the body more susceptible to infections. This becomes particularly problematic with lung cancer, as the disease damages lung tissue and impairs normal lung function. 4. Eye problems. You might be surprised to learn that lung cancer can also lead to issues with the eyes, but this is a well-known symptom in many diseases, including lung cancer. One of the most common eye-related symptoms of lung cancer is Horner's syndrome. This occurs when a Pancoast tumor, located at the top of the lung, disturbs the sympathetic nerves. People with Horner's syndrome may experience slight drooping of the eyelid on the affected side, which can give them a tired appearance. The pupil on that side may become constricted, appearing smaller than the other. Another subtle symptom is a lack of sweating on the affected side of the face, which is often overlooked. In some cases, people may also experience changes in vision if the tumor presses on the optic nerve or disrupts the blood flow needed to maintain eye health. These subtle changes, like slight blurriness or difficulty focusing, are usually not noticed until the symptoms become more severe. One of the key factors behind how Pancoast tumors affect the eyes is their impact on the sympathetic nerve chain, which runs along the neck to the face. This chain includes the cervical sympathetic nerves that control parts of the eye and eyelid. If a tumor presses on or damages these nerves, it disrupts their function, causing a range of eye-related problems. 5. Difficulty swallowing. Struggle to swallow or feeling like food is getting stuck in your throat is more than just a minor discomfort. It could be a sign of lung cancer. This symptom occurs when a tumor grows near the esophagus, the tube that carries food to the stomach. If the tumor is located in the upper part of the lungs or has spread to nearby lymph nodes, it can exert pressure on the esophagus, narrowing it and making it more difficult for food and liquids to pass through. This narrowing sensation makes it feel like food is stuck in the throat or chest. The lungs and esophagus share some nerve pathways, and if a tumor attacks these nerves, it can interfere with the swallowing process. One of the key nerves affected is the vagus nerve, which plays a crucial role in controlling swallowing. When this nerve's function is compromised, it disrupts the rhythmic movements required for proper swallowing, making it harder to eat and drink. Difficulty swallowing continued. When difficulty swallowing occurs, it's not just a physical issue, it can significantly impact your emotional and social life. Imagine sitting down for a meal, a time meant for enjoying food in the company of others, but instead, you feel anxious and uncomfortable because swallowing becomes a struggle. This feeling can make you miss out on one of life's simplest pleasures, leading to a sense of isolation or embarrassment at the dinner table. 6. Hoarseness or changes in voice. While hoarseness or voice changes don't immediately point to lung cancer, they are symptoms worth paying attention to. Hoarseness refers to any change in your voice that makes it sound breathy, raspy, or weaker than usual. If you notice your voice is tiring easily, or you can't maintain a consistent pitch, it's a good idea to investigate further. This is especially troubling because voice changes affect how you communicate, impacting social interactions and personal relationships. One key reason for hoarseness in lung cancer is damage to the recurrent laryngeal nerve, which helps control the muscles of your voice box. This nerve runs near the lungs and lymph nodes in the chest. If a tumor develops in the upper left lung or cancer spreads to nearby lymph nodes, these tumors may press on the nerve. When this happens, speaking clearly becomes difficult because the nerve can no longer function properly, leading to a raspy, strained voice. 7. Changes in the appearance of fingernail shave. You ever noticed your fingernails looking a little different? it could actually be a sign of lung cancer. The appearance of the fingernails can change, particularly in a condition known as clubbing. Clubbing refers to changes in the areas around and beneath the nails, indicating a hidden health problem. It's commonly linked to low oxygen levels in the blood, which is a common issue for people with lung cancer. As the disease affects the lung's ability to absorb oxygen efficiently, oxygen levels in the blood decrease, prompting changes in the blood vessels that supply the fingers. This can lead to clubbing, where the tissues under the nail bed swell and cause the nails to curve outward. The nails themselves become more rounded and spoon-shaped, and the nail bed softens. This distinct change in the nails is caused by substances released by tumor cells, such as hormones or growth factors, which encourage small blood vessels in the nail beds to expand, creating the characteristic clubbed appearance. 8. Unexpected shoulder or arm pain. Shoulder or arm pain, particularly if it's persistent and not tied to any injury, can be a major warning sign of lung cancer. This pain is often associated with a specific type of tumor called a Pancoast tumor. These tumors are located at the top of the lung, near the apex, and are known for their unique symptoms because of their position. The top of the lung is in close proximity to a network of nerves called the brachial plexus, which controls the nerves to the arms and hands. When a Pancoast tumor grows, it affects these nerves, leading to pain and discomfort in the shoulder or arm. This pain can feel like a deep, aching soreness, or in some cases, sharp and shooting. As the tumor presses on the nerves, it may also cause sensations like numbness, tingling, or even weakness in the shoulder, arm, or hand. This discomfort is often misunderstood as a muscular issue, but is, in fact, a red flag that needs medical attention. As the tumor grows, the pain intensifies, often becoming constant and more severe. At first, the discomfort may be mild and irregular, but as time goes on, the pain can worsen with specific movements or at night, making sleep difficult. This ongoing pain, especially when combined with other symptoms, should not be ignored. 9. Worsening bone pain. Worsening bone pain is another significant symptom of lung cancer that can severely affect your quality of life. It makes everyday activities more difficult, sometimes even unbearable. This type of pain typically indicates that the cancer has spread from the lungs to other parts of the body, such as the bones, in a process known as metastasis. When lung cancer cells break away from the primary tumor, they travel through the bloodstream or lymphatic system to other areas of the body. The bones are a common site for these cancer cells to settle, where they form new tumors. Bone metastases disrupt the normal balance between bone breakdown and rebuilding, weakening the bones and making them more sensitive to pain and fractures. Additionally, cancer cells in the bones produce substances that activate osteoclast cells responsible for breaking down bone tissue. This increased activity leads to excessive bone breakdown, causing significant pain, especially in weight-bearing bones like the spine, hips, and legs. 10. Unexplained weight gain. Unexplained weight changes, whether through weight loss or weight gain, also a symptom to watch for in lung cancer. If you experience significant fluctuations in weight without making any changes to your diet or exercise habits, it could be linked to the disease. Cancer cells require a large amount of energy to grow and multiply, which increases the body's metabolic rate. As lung cancer develops, it can cause the body to burn calories at a faster rate than usual, leading to unintentional weight loss. Additionally, the presence of cancer triggers systemic inflammation, which alters metabolism and muscle composition. This inflammation can cause muscle wasting, where the body loses both fat and muscle rapidly, contributing further to weight loss. Sometimes, lung tumors release hormones that they shouldn't. One example being a hormone that stimulates the production of cortisol. Excess cortisol leads to a condition called Cushing's syndrome, which results in weight gain, particularly around the abdomen and face. Other signs may include easy bruising and purple stretch marks. If you notice any unusual weight fluctuations, it is important not to dismiss them. Consult with your doctor for further evaluation. Lung cancer is often a silent and insidious disease, but awareness and early detection are key to improving treatment outcomes. If you or a loved one have noticed any of these symptoms, it's critical to consult with a healthcare professional as soon as possible. Early intervention can significantly improve your chances of receiving timely treatment and recovery. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Who knows, it might just save a life. For more valuable health insights, make sure to subscribe to Health Horizon and turn on the notification bell so you never miss our latest updates. Stay informed, stay healthy, and take care of yourself. See you in the next video.